How do brain scans show white matter changes in schizophrenia? Imagine your brain as a busy city with roads connecting different neighborhoods. These roads are like white matter pathways that help messages travel quickly and smoothly. When someone has schizophrenia, these roads can get damaged or disrupted. Brain scans like magnetic resonance imaging and diffusion tensor imaging help us see these changes clearly. Magnetic resonance imaging creates detailed pictures of the brain's structure, showing us where the white matter might be thinner or less organized. Diffusion tensor imaging is even more specific because it tracks how water molecules move along these white matter fibers. If water movement is abnormal, it suggests the fibers are damaged or disorganized. Most white matter changes in schizophrenia happen in specific areas, especially in the front and side parts of the brain. These areas are important for thinking, emotions, and decision-making. Key pathways affected include the uncinate fasciculus and arcuate fasciculus, which connect the front and side parts of the brain. The corpus callosum, which links the two halves of the brain, can also show abnormalities. These disruptions mean that different parts of the brain can't communicate as well as they should. This can lead to some of the symptoms seen in schizophrenia, like trouble thinking clearly or managing emotions. Research shows that even before symptoms appear, people at high risk for schizophrenia often have white matter differences. This suggests that these changes might happen early and could even contribute to developing the disorder. Brain scans also reveal that these white matter issues can get worse over time, especially during adolescence when the brain is still growing. This ongoing change might explain why symptoms can become more severe or why some people experience a decline after diagnosis. In addition to seeing structural changes, scans sometimes show increased density of certain neurons in the white matter underneath the brain's outer layer. This might reflect underlying cellular problems that add to the white matter damage. All these findings help us understand that schizophrenia is partly a disorder of brain connectivity. While brain scans alone can't diagnose the condition, they give us important clues about what's happening inside the brain. They also help identify people who might be at risk and guide future treatments aimed at improving white matter health.